Okay, so I made this video again, and then I accidentally deleted it and I couldn't recover it. I'm sad for that because it was a great video. Ugh. So we left off, made it to my room. You know, I got to the hospital. I was never been so happy in my life to see nurses before. I knew once I got to the hospital, everything was going to be okay because I could get an IV, I could get some IV pain medication, and I would get a little break, which is all I needed was just a little break. I have not before labored where I wasn't in the hospital. So, you know, there comes a point in every labor where a woman goes, I don't have it in me anymore. It needs to stop. I can't do this anymore. And it's kind of like a breaking point. They reach their breaking point. I reached my breaking point while I was in the car on the way to Las Vegas. And when I got to the hospital, I was 6 centimeters when they checked me, and 6 to 7 centimeters is about the time where they tell you, sorry, you can't have any more IV pain medication. Mainly because IV pain medication tends to linger in your system for about 2 hours. And usually when we get to around 7 centimeters, usually it progresses quickly enough, and within 2 hours, we're going to be delivering. So the concern is if we give you IV pain medication, and then within that 2 hours, your baby comes, then your baby can still be depressed from that pain medication. So we generally don't give it at that point just in case, because we don't want to relax you so much that your baby comes out in 10 minutes and is all drugged up on pain medication, because then we have to have NICU involved. So I knew the second they gave me, or they told me I was 6, they were not going to give me any pain medication. And I did not tolerate that information at all. I was begging and pleading and trying to like cut a deal with the nurses to please just give me some pain medicine. My husband says we were not even there an hour, and I had asked to be checked again, and I was already 9 centimeters. So, I mean, even at that point, I remember going, please. I put my arm in one of the nurses' face, like, please, just give me something. It'll be fine. Because I was not tolerating it. She checked me, though, because I remember that we finally got me in bed. Everybody was driving me crazy. One of the docs was in there in case the baby came real quick. They were getting my clothes off me. They're putting IVs in. They were checking me and doing all these things. And I just remember being irritated by everybody. One of the docs, who's a friend of mine, she kept trying to put a gown on me, and I kept yelling at her to stop trying to put a gown on me. She kept like touching me and patting me. And I'm like, I remember at one point, I'm like, stop fucking touching me. Stop. Don't touch me again. And I was not nice to anybody. I did not put a gown on. I didn't want a gown on. I remember with my other labors, that was the thing that probably bothered me more than anything, was the gown. I didn't want the gown to be wet, and I didn't like it tangled up around me. I didn't want it on. So I actually labored in this bra right here. It's just a stretchy, I don't know where I got it from. Probably my aunt or something. It's just a stretchy, like, I don't know if it's made of microfiber or what it is, but it's just stretchy, and it's super comfy, and I love it. I wear it to bed, actually, because it's just so comfortable. And I had asked her to check me. Oh, excuse me. Because I started to feel that pressure, and I started grunting down with the contractions. And then that's when she told me I was like 8 to 9 or something. And things just got kind of crazy from there. I wasn't tolerating it. I was still very uncomfortable. I was freaking out, honestly. And I eventually sat up like I had been possessed and said, where the fuck is the doctor at? Where is anesthesia? Is she not here? Is she at home? Are we waiting for her to come from home? Is that what's going on here? And my nurse said, no, she's in house. Let me find her. So I did end up getting an epidural. I know you guys probably will tell me something different, but I feel like I let myself down. I'm disappointed in myself that I feel like I gave in getting an epidural. I have done this 3 times without an epidural. I've made it through. I've been fine. However, like I said, I had only been in the hospital when I reached the breaking point that I can't do this any longer point. And this time I didn't get that pain medication to help me get through that hump. I think had I been in the hospital and been allowed to have some pain relief beforehand, that it would have played out very differently. All of my labors, while they were varying in intensity and length, all kind of followed the similar pattern. Come in, induce, break water, ask for pain medication. Ooh. Pain medicine wears off, have a baby. Ooh. What's going on, pups? And that didn't happen this time. I was too far along, so I didn't get that halfway point, that break halfway through. And I didn't tolerate that. So 9 centimeters, I got an epidural. That being said, I have a lot of anxiety when it comes to epidurals and C-sections and whatnot. They cause me to panic a little bit. You guys know I only yawn like this when I make videos. I wasn't yawning like this before I started this video. And so anesthesia comes in and tries to start explaining to me what's going to happen. And I said, hey, look, I work here. I know, just get it done. And I said exactly like that. I didn't want to hear the BS talk and the explanations. I've heard it 1,000 times before. And so we sit up, and I will tell you from the get-go, I did not enjoy this. I've heard it 1,000 times. Patients always ask me, oh, how does it hurt? Is it, whatever. And I've always had to say, I don't know. I've never had one. And usually at that point, anesthesia will chime in and say, a lot of people say that the IV start hurts more than the epidural does. I'm going to disagree with that. I did not enjoy that at all. I didn't enjoy a second of it. I didn't enjoy the lidocaine stinging and burning as it was numbing my skin. I didn't enjoy the pressure of the epidural needle going in. I didn't enjoy the catheter being inserted. I didn't enjoy any of it. And I'm pretty sure, actually, I'm 100% sure that I hollered through the entire thing. I bitched and moaned about this epidural the entire time. And I actually said, that is a lie. This does not hurt less than the IV. We are fucking liars. I did not tolerate that insertion. And I don't know how that poor doctor managed to keep her cool back there, because I was acting a damn fool, you guys. I seriously was making so much noise about it, but I did not like it at all. And I didn't like it once it kicked in. I did not mind the pain relief, but I didn't enjoy the numbness. When Debbie sat me down after they'd placed the epidural, she checked me again, and she was like, okay, let's go ahead and start pushing. So I tried to push, and this is legitimately what I look like. Like this. Like, I looked like I was having a seizure of some sort, I'm sure. Because, here I am with this big old grand belly out to here, right? And my skin, I can feel everything on my skin, but I can't feel anything underneath it. I can feel my nurse touching me down there, but I can't do anything about it. And I hadn't even lost full function yet. Like, I wasn't even completely numb at this point. I was just starting to get numb. I couldn't do it. Like, I knew how to push, but I physically could not push. It was so weird. I remember telling her later that it felt like somebody had filled my belly up with air, and they were asking me to push it out, and I couldn't do it. I don't know how else to describe it. I mean, it was so difficult. So I had that epidural on maybe 10 minutes and we tried to push. No. No, get out of that. That's not for you. She's trying to eat my chocolate. I had that epidural on maybe 10 minutes before I was like, can we just turn this off? Do we have to keep it on? I got real numb real fast. Doc really loaded me up real quick because I was making noise at her once we laid back down too. No, Molly. And I asked my nurse to turn it off because I wasn't tolerating it. I didn't like it. I kept my husband said, I kept tapping on my legs like this and going, I don't like this. I don't like it. And I remember feeling like I had something sitting on my vagina, even though there was nothing there. Like there wasn't even a blanket on it. So eventually I got my nurse to just turn it off. So I did get pain relief though, which was really nice. My mom at the point where I sat up for an epidural had just arrived. She legitimately was trying to walk in the door as we were sitting up to put the epidural in. So she came in after the epidural was in, but before the mailman came and dropped off the mail. The dogs acted like we were being murdered. Okay, so mom came in the room after the epidural was placed, but before it was effective. And my husband told me later that she came in and basically took one look at me and how much pain I was in and sat down and started crying in a corner. He goes, Ginger, she was so upset seeing you uncomfortable like that. He goes, we had to keep telling her it was okay. It's okay. It's okay. She's going to be fine. Everything's okay. But yeah, he said she was just so upset. I don't remember her coming in the room. I remember her being in the room afterwards. After the epidural kicked in and I was comfortable, then the adrenaline shake started and I got very shivery, and not because I was cold, and so many families think it's because they're cold, but it's more of a fight or flight. You get in a car accident or you're really scared and you're real shaky afterwards. It's the same thing in labor when the pain goes away. But she did awesome afterward. She had me covered up because she thought I was cold, and she took care of me. She mommed me. And it was nice. I usually don't tolerate people fussing over me like that when I'm in labor. I usually just kind of like to be left alone. But she was great. She was very gentle. My bangs drive me crazy, and I kept pushing them out of my way like this. I tried to keep my hair out of my way. She kept just making sure it was out of my way and just petting me like this. And for some reason, I don't know if I was just more tolerant of it because I didn't want to be rude or what, but I was tolerant of it and I didn't mind it, and I just let her keep petting my head. And at one point I remember I kind of leaned into it a little bit. So it was nice. Eventually, not too long thereafter, I started to feel the pressure again in my bottom, and we started pushing again. My husband told me later that we pushed for a total of 2 hours, which is my longest pushing session. My daughter, who had the biggest head, was only an hour of pushing, and my son, who was the biggest baby, was a half an hour of pushing. So 2 hours of full-on pushing effort. I remember telling Debbie at one point, I feel like I need to rock and I need to wiggle like this. And she goes, okay, go ahead and do it. And so I did in between contractions. And now I understand what that means. But, to feel it is something different. And usually, if your body's telling you to do something, it needs you to do it because it's helping that baby get in the position it needs. And I understand even more so now, listening to what my husband has said about the delivery, why I felt like that. As time went on and we were pushing and pushing and he kept coming lower and lower, I felt like it was taking forever. And it really did. Even my husband said, he goes, it took forever for you to get that baby out, honey. He's convinced that if I didn't have an epidural, it would have been half an hour, we'd been done. But I'm not so sure. He told me when baby was coming out that the baby's ear was facing up towards the ceiling. Normally, for moms who did education, this part of the head is what comes out first. So the top of your pubic bone is actually on the back of the baby's head. So if you're, this is the top of your pubic bone, the front of your pubic, the baby's actually like this. So the face is down and this part is up towards the roof. Because that's the narrowest part of the head, and it's the part of the head that molds the best. And that was not the case here. I remember as I was pushing and as he was moving down lower and lower, I remember thinking, it feels like he is taking up every single available square inch of space I've got in my pelvis. I even asked at one point, I said, Debbie, can't the doctor just come in and please vacuum him out? And she said, no, that's not happening. You're pushing this baby out. And so we kept pushing. Eventually we got to the point where doc came in. It was time to deliver. And there was a lot of burning. There was a lot of me yelling at my doctor to keep his hands out and don't touch me. Oh my God, your hands feel enormous. Just me feeling like I wasn't going to be able to get him out. I felt like he was just so big and so much in there that I wasn't going to be able to get him out at all. And I remember saying something to that effect to my doctor, and asking him to please just get this baby out because I can't do it. But he came out, obviously. And my husband told me that his ear was actually facing up towards the roof instead of the back of his head. The ear was the first thing they saw. So that leads me to believe that he was in there sideways. And looking at him afterwards, he was kind of like this as well, because he had the molding was like right here instead of back here. So he was kind of off center and looking sideways. So that is why it took so long to get him out, because he was in there all cattywampus. But he finally came out 10:57 Christmas morning. He weighed a whole 7 pounds, 12 ounces. And he had the most crazy amount of hair I've ever seen in my life on a newborn baby. I would have been sadly disappointed if this baby had come out bald. Because, the wives' tale is you get heartburn and it usually means baby's got a lot of hair. Holy crap, did this baby have a lot of hair. He's got a full head of hair is what he's got. He's not just a little hair. He's got hair. So that was exciting. And everything was okay. Bottom was intact. Doc apologized to me later for putting his hands all up in my business, because he said, if I didn't, you were going to tear it. I didn't want you to tear. So it was good. It was a long delivery, but it was a good delivery. I was very nervous, more so about anything, having my husband in there. Not so much having him in there. I needed my husband in there, but I was worried how my husband would tolerate this. I feel like husbands are probably the biggest factor in whether or not we as women decide to do this. We're not sure, how they're going to take it. And men have such different feelings about these things sometimes. And my husband especially has very mixed feelings about this. It took me a long time to get him on board with this. I mean, years of me slowly coming back to the topic and bringing it up again and discussing it more and more with him. He was very uncomfortable with it. He was uncomfortable with so much about it from the get-go. He wasn't comfortable with the medications. He gave me all my shots. He wasn't comfortable doing that, but he did them anyway. He had his own... Stop it. My dogs are stupid. He had to get over his own personal thoughts about, she's going to be pregnant with somebody else's child. Okay, sorry again. The mailman shows up and the dogs think we're all being murdered. No. And so I wasn't sure how he would handle all this. He had to get over his own feelings about it and, come to terms with some things that he wasn't necessarily comfortable with. So he wasn't necessarily excited about this whole process, but he was supportive, and that was what was important. He went along with it because it was important for me to do it. It was important to me for me to do it. And so he went along with it. That being said, it did affect our relationship a little bit. You know, it affected our sex life greatly. It was very weird for him to think about having sex during this pregnancy. It was just everything about our relationship shifted. It wasn't a bad shift, and it wasn't negative, and there was no hostility. There was no resentment, nothing like that. It just shifted there was just a weird, like, drift apart almost. I mean, our relationship was still healthy, but the intimacy part of it was very different. And so I wasn't really sure how he was going to handle this part of it. I never doubted for a second that my husband wouldn't have my back. I knew having him there, he would absolutely make sure I was taken care of. It was always very important that he was in the room with me, because I knew in the end he would speak up for me. And he would do what was safest and best for me. And I knew that he would do the same for this baby. Even though it's not his, he told me, my job is to get you there, make sure you and this baby are happy, healthy, and safe, and that he comes out okay. And then make sure he goes to his parents. And so, I mean, I knew that I was safe, and I knew that I was in good hands, and I knew that the baby would be okay, and I knew I would be okay, and I knew if there was anything that was going wrong or there was issues, my husband was going to have it taken care of. There was never a question. But I just wasn't sure how he would emotionally handle this delivery. You know, I wasn't sure, and I don't think he was either. I think he was surprised at himself as well. So baby comes out, and baby's crowning, and I remember my husband turning and looking at me and going, "Oh my God, babe, I can see his ears. Oh my God, he's got the cutest ears." And he was just so excited, you guys. It was so funny. I mean, even at the time, I remember thinking, what is he talking about his ears? You know, he was so excited. Even now it's been 2 weeks, and it just gets me every time when I think about how excited my husband was when this baby came out. I mean, really, there was no difference in how he behaved when our son came as to when baby came this time. We call him Cletus. When Cletus came, he was so excited. It was so awesome. I mean, and he was so proud of me. Like, I've got one video right after the baby came. It's like 30 seconds. And he's looking at him. He's like, look at him. Oh my God, look at him. And at one point he turns to me. He's like, you did great, honey. Good job, babe. And I was like, yeah. Back down I went. But he was just so excited about it, you guys. I mean, even when we get pictures of him, like, my husband's got all of the pictures and all of the videos about this baby saved on his phone. You know, he didn't tell anybody at work. There's only like 3 people at his work that know about the surrogacy. And 2 of them are his office ladies who have been like in secret discussing it with each other because they're the only 2 that knew for the longest time. And he goes, the girls in the office were super excited. And I go, did you tell him we delivered? He goes, yeah. I go, did you show him the pictures? And he goes, yeah. He goes, they think he's just as cute as I think he is. Like, my husband he's just like, God. He looks at the pictures and he's like, God, he really is just a good looking boy, isn't he? Look at him. Look at him. He's a good looking kid. And I mean, the dad didn't get there. He was actually on his flight from Beijing when I delivered. So he was in the air. So he didn't even know he'd become a dad until he landed. And my husband, when he met him, that was really what he was most worried about, was because he wasn't sure how he would tolerate meeting the man whose child was inside of me. And even when he met him, my husband was just so excited for him that he became a dad, and this guy got his son, and like, he was so excited for him. I mean, it was awesome. Like, my husband's reaction to the whole thing is like one of my top 5 moments from this whole entire process. Like, I'm just floored at how excited my husband was about this baby coming. I mean, he's just, yeah, it's just crazy. Like, it's just crazy how excited my husband got about it because he was so weird about it for so long. It was crazy. And then in that video that he showed, my number one moment, because, I was all in a crazy stupor. My number one moment of all of it was in the video, this 30-second video of right after delivery. There's a part where they're taking the baby from me. I asked not to have him on me. I didn't want to hold him before mom. There's a part where, so baby's just come out and doctor's cutting the cord. Mom did not want to cut the cord. And the nurse is taking the baby over to the warmer, and mom is standing right here by me, and she watches her son go to the warmer and turns to come back and take care of me. I can see that she wants to go to her son, but she feels obligated to come to me. And in the video, she's just bawling, just tears everywhere. And all of us are telling her, go see your son, go see your son. And she did. But it's like a 2-second clip of her, just her face. And it was just, oh, it's just awesome. It makes it worth it. It was awesome. It was so awesome. I mean, I get to help people make a family every day. Not make a family, but bring their family into the world and help them deliver these babies and do things that they don't think they can do. But I've never got to do it like this. Like, this was my first surrogate pregnancy. And yeah, I'm not usually a super emotional person. I seem like it, but I'm really not. And so, I mean, I'm real good at just clicking off those emotions, but man, just seeing this, it's totally different. Like, totally different. I told my parents at this point, the only thing I can say for sure is that if they wanted another child, I would carry for them again. Everything else is kind of up in the air, and me and my husband are just going to take it day by day. But right now we're just focusing on getting me better and happy and comfortable. Excuse me. I've only got 4 more weeks off from work, so about 4 weeks to get my life in order. But yeah, it was a pretty awesome day. I mean, it was definitely a Christmas for the record books. Yeah, so I mean, I don't know, you guys. I'm not sure. Kind of just go from here. So I will see you guys soon, maybe. Yeah.